It's not letting us flip it, so I'll have to set it back. Orientation is locked. The device back. Auto orientation. Why is it not letting us rotate it?
Oh, it's okay now.
Okay, pause. Like somebody has connected already. Please try to connect so that we can see this kind like video on landscape. Anybody there to get that? Who has connected already? You have to go to your settings to put it like that. So you have to off the light and go back.
Just
So you put it like this. For people that are viewing it, it will be showing like upside down. Yes. I don't want to do like this. How are you today? So today we are going to continue with the topic where we stopped, right? Parenteral administration. So remember the last class that we had? We stopped at parenteral root of drug administration. So we are going to continue. And if you are asked during examination that whether different types of parenteral drug administration, please do not mistake it to like only intradermal or intramuscular. Intramuscular, intradermal, intravenous. Do you understand? Like the one you're seeing on the screen now, that these are some of the parenteral routes of drug administration that we have. So, to mention very few, we are going to look at subcutaneous injection, intradermal, intramuscular, intravenous, intraarterial, intraosseous injections, right? Drug of parenteral route of drug administration. So now during exams you may be asked, whether to list parenteral routes of drug administration. They can ask you to list 5. There are many. They can ask you to list 5. They can ask you to list 3. They can ask you, depending on the question that which the examiner asks you, right? So what you should do is just go straight to the point and list them. Please do not mistaken it to only intravenous or intramuscular only, right? So now we are done with the principles guiding drug administration, isn't it? We are done with all those things, all those ones. So we are going to look at intramuscular injection, right? Intramuscular administration of medication. So now, when you are asked to carry out as a nurse, as a student nurse, you are asked to the different routes that we can administer medication, isn't it? As I mentioned earlier, we have oral routes of drug administration, we have parenteral. These are the two major types of routes of drug administration, orally and parenteral. We're going to dwell on parenteral drug administration, isn't it? And we are going to concentrate on intramuscular. Do you understand? So, please do not get what I'm saying. Alright, so under parenteral we have intramuscular, intradermal, intravenous, continue. Don't worry, you understand that, uncle. We reach there, right? What's that your name? Aaron. Due to the nature of the medication, the nature of the medication will determine the route of drug administration, right? You understand? Like now, I want to administer insulin, and I want that insulin to be absorbed what? Slowly in the body, right? And I will give it subcutaneously, isn't it? If I want to do Mantoux test for tuberculosis, I will give it intradermal so that the body will. You understand? So, depending on what really they want to achieve, the manufacturer or the person that discovered the medication will determine which one is suitable for this particular medication. Is it intramuscularly? Is it subcutaneously? Is it intradermal or intravenously? Do you understand? So, now let's look at anatomy of what? Syringe. Please class, take photo of this. Yeah, I may decide to do it just during your exams. I may just break this one and say let me help this. That's all. Okay. Right? So we have the what? The T, the plunger, right? Everybody look up, look up, look up. Look up. Everybody look up. This is the T, right? The plunger, isn't it? Isn't it? Then we have the barrels, right? We have the barrel, isn't it? And we have the what? The flank. The flank. This is the flank, right? Okay, this is the flank. Where's my ruler? This is the flank, right? I used to have one big, large, what is it? Syringe. So I prefer using it because everybody can see, right? So just concentrate. This is the flank, right? The barrel, the tip, isn't it? Then what? The plunger tip. You You know the plunger tip is this one. It's right inside, isn't it? The plunger tip. So sometimes during Viva, they will just place this way and say identify and name all the parts. Yes. So we have the tip, the barrel, the flank, the what? Plunger. We have the plunger itself, then the plunger tip, right? Then what again? Then we have volume markings, the graduations, right? Volume markings here. Any question? Any question? Any question, class? So, all right. So let's look at also our needle. No, I don't understand what you mean by needle. What you mean? I've not seen needle before. I've not seen needle before. God's blessing, I don't understand what needle. I don't know the name. So we have the word. Hey, everybody, look up. Look up. Do you understand? So this is 200 level class. So it's just like beginners for what? For medication, right? So we have needle cap, right? So we have the needle hook. This one. We have the needle hook, right? The needle hook, this particular one. And then we have the what? The lumen. Do you know this opening at the tip of your needle?
Yes, ma'am.
That's the lumen, isn't it? That's the lumen, right? So, and again we have the what? The bevel, right? The bevel. So, and we have the shaft. This is the shaft, right? This is the shaft and the what? The bevel, right? So, now, any question now on syringe and needle? So, the next thing is for us to look at, these are the different sizes of needles we want to. So, indication for parenteral drug administration. Volume for emergency. Maybe a child was brought to your unit and you are asked, like you are asked to administer. You cannot give that patient what is it called? Oral medication. It's going to digest and the body will start absorbing it. Isn't it? So you go straight. That's the indication for one of the indications for what? Parenteral drug administration. And we have what? Means of what? Dosage. And suitable for large volume and for irritant substance. Then we have for unconscious patients inability to tolerate oral drugs, of which I have mentioned them already. Advantages. So let's look at sites for drug administration. Intramuscular. Let's look at sites. Right? So let's look at sites for administration of these medication. Intramuscular injection of deltoid muscles. The injection site for deltoid is being located in the middle part of the right arm, for example, class. I don't know. Let me put it more. So now I have an arm like this, isn't it? The patient comes in and you want to use the deltoid muscles. And of course it's intramuscular. So what are we going to do now? If the patient maybe sits or stand, just place your form a V with your middle finger and index finger like this and place it this way. You see, the middle, this aspect is where you are going to work, administer the medication, give the intramuscular. Do you understand? Don't go and do it on somebody's bone. No. Don't go and do on somebody's bone, right? Place this way and then you administer the medication. Do you understand? So, Any question? For intramuscular on what? Deltoid muscle. Do you understand? And then you administer. I'm trying to give you this prayer so that you have knowledge when we start the procedure itself. So the next one is intramuscular injection medication can be administered on the what? On the thighs, right? On the thighs, on the vastus lateralis, on the outer middle third, on the outer middle third of the thigh. For example, class. Now you have a patient that you want to administer intramuscular on the thigh. So what you have to do is divide the thigh into what? Into 3. This is my patient. Permit me to remove my patient clothing. So now, let me remove these legs so everybody can see. This is the thigh, isn't it? From the hip, right, to the knee. Do you understand? From the hip to the knee. So now, you are going to you want to administer intramuscular injection. So what you have to do is for you to divide this thigh into 3. This way, 1, 2, 3, like this. Do you understand? 1 this part, the second one the middle, then the third one here. Do you understand? So the one in the middle, that's the one you're going to administer the injection. This space in the middle, that's the one you're going to administer the injection. Do you understand? Is anybody confused? Hello? You are the back. Is anybody confused? So when you divide the thigh, no matter how big the patient is, you understand? So you divide the thigh into 1, 2, 3. The one in the middle, that's the space you are going to. But the outermost part, now we divide it this way, right? 1, 2, 3. Now our attention is only in the middle. Do you understand? So now in the middle, you are not just going to like do it right in the middle or here because you chose the middle, isn't it? So you are going to give the outer part of the middle. Do you understand? Not this way, but this way. Do you understand? So now let's take for example, after getting the middle part of the thigh, you divide it into 2. Then the other side that is outer, not the one close to your, let's say, vagina or pubic area, right? The one that is outside this way. That's what, not too outside, like outermost. So the second part of it, that's the area you're going to. We are done with the deltoid muscles, isn't it? You understood, right? Yes. So now, thigh. Do you understand?
Yes.
The vastus lateralis muscle. So sometimes during us, they will just create a scenario and say, administer this medication on the what? On the vastus lateralis of this patient. If you don't know your anatomy, isn't it? You will not know where to administer. And you start sweating. You start getting anxious. What is vastus lateralis now? What is it? Or we just mentioned vastus lateralis, outer middle third. Right? I hope you are seeing. You see the location of that large muscle there. You administer medication on that muscle. And the name of the muscle is what? Vastus lateralis. Isn't it? So please familiarize yourself with your anatomy, isn't it? Do you understand? So that you can be able to what? Pass your exams. Any question? Okay, do you understand? Alright. So the next 16 part we have let's look at the gluteal muscles. The gluteal muscles is the buttocks, right? Right, the buttocks, isn't it? Now, you want to administer medication on this particular patient, but they said that you administer a deep intramuscular on the gluteal muscles, isn't it? And the gluteal muscles will be located on the what? Buttocks. The first one we said what? Deltoid muscles. The second one, Vastus lateralis, isn't it? And the third one is what? Gluteal. These are the three common intramuscular sites. Three most common intramuscular sites are of administering medication parenterally. Do you understand? Is anybody confused? I'm giving this background so that when we start the procedure, nobody will have problem, isn't it? When I mention a particular muscle, when I mention a particular site, you will not have issues. Do you understand? Have you done this in your anatomy class? So I can go ahead to my procedure, right? Okay. So when it comes to gluteal muscles, you are going to administer the medication at the outer part of the gluteal muscles, right? So now, for example, so, for example, I have my buttocks this way, isn't it? Just please, class, before I go further, you want to administer medication. I hope you know that we have different shapes. Our buttocks, whether you are male, female, right? We have different shape of buttocks. Please, whenever you want to administer medication on the buttocks, make sure that the patient pull his trouser till you see the septum in between the two buttocks. Like this. Let's turn the patient this way until you see this septum. Do you understand? Until you see this septum. Why? Because some people are obese and the abdominal muscles, right? These muscles from the back is here. So if you don't see this septum, you mistaken that muscle here and administer medication here instead of what? Here. Instead of here. Instead of these outer quadrants of the gluteal muscles. Quadrant, right? You divide it into four, isn't it? The outer quadrants of the gluteal muscles, right? So ensure that you see this septum, even if it is little, isn't it? Even if it is small. What is that girl lady doing there? Even if it is small, right? So that you are sure that you are at the right place. So we divide the buttocks into what? Into four. So most times till today, for me, if I want to administer medication, what I used to do is that I will carry my wet swab, that is my spiritual swab, and I will do like this. Divide the buttocks after seeing the septum. Divide the buttocks this way, right? Make a cross sign. Then the outer part here, then I administer my medication. Till today, I'm still doing this, just to be sure, to avoid abscess, giving injection in the wrong site. So, for it, now, some obese patients or slim patients, you may end up giving it here because there are no muscles around, right? You're just seeing skin. And the prescription sheet says Intramuscular. So what will you do? You help yourself, or you use wisdom and divide it into four, and the upper outer quadrants of these gluteal muscles, you administer the medication. Do you understand? Class?
Yes, ma'am.
Who is confused? Who is there? So now, we want to go into the procedure properly. Are we okay with the sites? The common site for administration of intramuscular injection. Right? We set our requirements. right? My requirement for this medication is when it's set and ready. It's set and ready, so we are going to administer this medication. Now, if the medication is, this is an ampoule, right? This is a vial. We call this one ampoule and we call this one vial, isn't it? So, during the examination, you may be asked withdraw medication either from the vial or from the ampoule. And they have two different methods of withdrawal. This one you break, right? While this one you don't break it, isn't it? You rather remove the teeth and then you dilute whatever that is inside, or you withdraw the medication. You understand? So there are techniques that which you can use to what? To break the ampoule or to withdraw medication from the what? Vial. So now I am going to show us the procedure, right? So of course it's a trolley procedure and it can be a trach procedure also, depending on some perspective set trach procedure like this, and some perspective set trolley procedure. So let's take, for example, we are going to use the deltoid muscle to administer this medication, right? The patient has been placed on a medication, let's say promethazine, and we want to administer the promethazine on the deltoid muscle, or TT, right? Tetanus toxoid, isn't it? It's very comfortable to administer it on the deltoid muscle. So the patient is being placed on TT medication, that is tetanus toxoid medication, right? So, first of all, please class, whenever you are going to administer medication, greet and introduce yourself to these patients, right? I call it normal formula. Of course, even during OSCE, if you don't know anything at all, do not come and stand and be looking at the patient, looking at the procedure. Say something. You can be able to do what? The normal formula, isn't it? What is that guy doing there? What are you doing there? What is in your hand? Can you look up? I hope you know this is practical class. So you must see, you must watch and see and practicalize it before you understand, right? So now, I said that you have to do your what? Normal formula. Normal formula in the sense that you have to greet and introduce yourself to your patient, obtain consent from the patient by explaining the procedure to the patient, and then you provide privacy. One, perform hand hygiene, and then don your glove. Now, we want to administer IM injection to this patient on the deltoid. Good morning, that's what you come and say. Good morning, how are you today? My name is Nurse Clement and I'm here to administer your medication. I am going to use syringe and needle to administer this medication on your upper arm. Can you please kindly tell me your full name and date of birth? And the patient will tell you his or her name. My name is so maybe Chukwuemeka Eze. And my date of birth is 10th May 2002. Then you cross-check with the information you are having in the patient's folder or the information you are having on your system. You cross-check. Do you remember the 5 R's we did? Right patient, right drug, right route, right time, and right what? Medication. Right? Now I have done what? I've identified the patient and I've cross-checked that is right patient. Right medication, the prescribed medication I'm checking. Do you understand? Right? And right time, it is 10 a.m. and I'm here to administer what? Medication to this patient. Do you understand? So as you are doing, you are observing the 5 rights. Right? And I cross-check the information. This is the name Chukwuemeka Eze, and he has been placed on TT medication, and I will admit the medication is being prescribed to administer on the deltoid muscles, isn't it? And I'm going to give the patient, right? You understand? Then I drop my prescription sheet right here. Now that I know the right medication, and I pick my medication, right? And I've seen, I will read to see whether it is the right medication. Yes, this is, for example, this is what? TT, isn't it? Tetanus toxoid what? Medication. Ampoule. This ampoule contains what? Tetanus toxoid medication, right? So, and now I notice I identify it as the right drug. You notice, and I check the expiration date. Is this drug expired? I put it at eye level and I check the expiration date. And I notice that the drug is not expired, right? And I keep my medication. Then I what? Go and wash my hand, perform hand hygiene, right? I perform hand hygiene, and I'll come and don my gloves, right? And I put on gloves. Now that I know that this is my right patient. Very important. Identification of your patients in the hospital, very important. So that you will not go and administer medication on the what? Wrong patients. Before you go, you kill somebody. Check, cross-check. If you do not understand, call your colleague, senior colleague, junior colleague, whosoever that you are on duty with. Please, can you help me kindly check the medication that which I want to administer to this patient? Is it right? Is it right? Or you are having eye problem and your glasses is not there. Please do not be proud. Kindly ask your colleague to help you check. Do we understand? So you don your glove. After donning your glove, right? The next thing is what? Prepare your medication. Hello class. Please do not break your needle, your syringe and needle this way. Do not break it this way, most especially during exams. Except in emergency situations, right? Please, during exams, do not break your this way. Not at all. Pick your syringe and needle this way, right? And peel it off. Most syringe and needles comes with this. Just take your time to peel it off this way, like this. You peel it this way. You understand? Then you remove the syringe, and what? This needle is not properly placed. It's supposed to be this way. It's supposed to be placed this way, like this, right? And then when you remove it, and then you what? Immediately when you remove the syringe, it's supposed to be placed this way. So I think the people that are producing these needs, which are needle, they are not doing well. So it's supposed to be this way. And then when you open, you quickly pick this way and then free from contamination. And then you place it. Then now you want to prepare your medication, isn't it? You're going to use ampoule, as I said earlier on. So you what? Do you see this dot? There is one dot here. It can be blue, it can be red, it can be white, it can be so. You turn this dot side. It has already been filed in the company. So you turn it this way to your side, facing you. Then you carry something, either the heel of this syringe or you carry cotton wool. For me, most times I prefer using this. Then you place your thumb towards this direction, right? Place it on the collar side, that dot side, and then you break it. That's all. That's all. But sometimes when you come, you start struggling. It's not. That means you didn't place your hand properly. You say I didn't struggle, isn't it? When you do that, you don't have to struggle. That mark indicates that this is where you have to apply pressure and break your arm. Make sure you protect your finger so that to prevent what? It may break. So to prevent piercing your hand with the bottle, you have to wrap it with either gauze, cotton wool, or the wrap of the syringe, and you discard it. Now, remember we have prepared our syringe and needle. Then you what? Put your thumb on the needle hook, and then what? When you want to remove it, when you want to remove the needle cap, right? Place your thumb like your finger here, right? Place it this way, and then, do you understand? So avoid like removing it together with the needle. Do you understand? So you have to press this colored side using maybe your fingernail, right? And just pull it. Then you what? You will draw your medication this way and start it. Let's say 0.5 ml. So after we've done 0.5 ml, immediately I recap, right? Then I expel what? Bubbles, air bubbles, right? I expel air bubbles. So, what we are going to do maybe next class, everybody will come with what? Or I'll come with it so you get it from me. Buy it from me. We come with syringe and then we come with what? At least water for injection. Everybody will withdraw, right? Everybody will withdraw so that we learn how to do the injection together. Then we'll get like a foam or orange. Just try to come with a foam or an orange, right? Just one orange, then we'll learn that. At least now we have idea, right? So when we come in next class or return demonstration, we'll do that. So after withdrawing this sheet, you see there are no air bubbles inside. Have you seen that? Always expel your air bubbles. Always. After expelling air bubbles, then you change the needle. You discard this needle into sharp box. And this is what we call what? Sharp box. Sharp box. This is what we call sharp box, right? So it has an opening here so that we can discard. So we remove this needle that we used to withdraw what? With that needle. We used to withdraw the medication. And then we discard it into what? The sharp box. Then we place new needle. Right? Then we are ready to administer. Now, I prepare my medication. I place the medication inside the receiver. I place dry swab. Then I place what? My spirited swab together in a kidney dish. Coming to my patient bedside. Remember, we are administering on the deltoid muscles. The patient is like this. Because I'm teaching you, that's why I want everybody to see. Do you understand? Yes. So now, I use my dry water, spirited swab, isn't it? And I clean in the circular motion. I clean in the circular motion. And I discard inside my receiver for use swab. And then I apply the same pressure down and I remove the needle. Do you understand the needle cap? Then I administer on what? 90 degrees. Have you seen my hand? Are you seeing? Then I inject immediately. Excuse me, please. 90 degrees. And I will draw back to see whether the needle is in the blood vessel. If there is no blood here, that means the needle is not in the blood vessel, so I can administer the medication. But if I quickly administer the medication, right, and I use my dry swab like this. Cut the needle inside what? Sharp box. Straight. I start and apply a little pressure, right? And in case you see blood while you are withdrawing back, isn't it? Quickly withdraw the whole thing. Do not administer. That means in the blood vessel, right? And you know this medication is supposed not to be in the vein. Do you understand? And don't forget the blood vessels, be it artery and vein, and what's the nerves? They are like electric wire. You know this red, black. They are always together, going together, right? So nerve is there, artery is there, and vein is there. So that means that blood is showing you that you are close to what? You are close to damage a nerve. You are close to a nerve. Or you might even touch a nerve, right? So you will quickly withdraw it, discard it, and withdraw another medication. Do you understand? Or you change to another position, isn't it? You can use the other arm. If it is buttocks, you can use the other side of the buttocks. Do you understand? Any question? Now that we are done administering this medication, right? What we are going to do is what? The next thing is to make our patients comfortable. Thank you, Mr. Eze. Thank you for cooperating with me. And what? I remove my glove, right? I remove my glove, do spray, and discard the glove at the bottom shelf. Then I'll go and perform hand hygiene. I wash my hands properly, and I'll come back now to what? Record. Very important. You don't joke with that. I record my medication. I record TT, right? I administer 10 a.m. and then I sign. Right? You do that on the job chart. So for report writing is a different thing entirely, right? Report writing is a different thing. This one is what? You have recorded for what? The drug you have administered on the what? Drug charts. Do you understand? Then you discard this equipment and you have to tell your patient, reassure your patient that if there is any problem, you should call your attention. If he's feeling any side effects, call your attention, or always you observe your patients, right? And we are done. That is for I. Any question, class? Sorry? Yes.
My first question is, why are we changing it? My second question is, you said if you see blood, we should remove it. Are we moving it to straight away to down that one, or we can just...
Yes, if the patient is having enough, why not change it now? And the patient is not having enough, you can't administer. I hope that you know that blood can occur, right? And it may cause injection abscess. Do you understand? So preferably start and withdraw another one. Remember, some patient doesn't have the money, right? Then what's the other question?
Why are we changing it? The one that we...
Now you withdraw. You are withdrawing this medication. Hello class, stop making noise. Now you are withdrawing this medication. See, let's take for example, this is my vial or what, or ampoule, and you have something like this. You want to withdraw, and the tip of this needle touches the base of the vial, or it has tempered with the sharpness of the needle. So when you want to inject the patient, you have this, you not have this smooth penetration, you just have this, you know. So that's why we change it, right? Sorry? You may use it, but professionally, please kindly change.
measure 25 grams of the ample of the
Sorry?
You said something like if a should measure like 25 grams of the for either the ample of the what is it? What is like all the are you going to do the thing or do the rest of it?
I don't understand. What do you mean?
Let's say the ample of the is like 100 grams, like 100 and what I went to administer to the patient, let's say 25 grams.
Is what?
25 grams, or do you always have to understand everything like this?
You say 100 grams and you have 25 grams.
So now
When you pick your needle
Yes,
and measure the. Okay, let me give you a simple example. This is 10 what? 10 mil. And I'm asked to administer what? The prescription says 2 mil. What will I do? I will draw 2 mil and the remaining 8 mil is there. If this medication can be reused, you put it inside the fridge, right? Make sure that you maintain the temperature so that the efficacy will still be retained. Do you understand? Right? Like ceftriaxone, when you go to the hospital, you see a lot of ceftriaxone in the fridge so that they are preserving it. And the patient doesn't have money, most especially in children's units, right? Pediatric ward, you will see one vial, the child can divide this vial into 5. So you don't have to discard it, you reuse it. You preserve it under a good temperature according to the manufacturer's instruction. Then you administer. Do you understand? What if stop making something? Yeah.
I'm going to attend to several patients. That procedure of washing hands, taking their whatever and everything, see that when I finish for one, I will discard everything, start again for the next patient, or I will take all of their.
So if it is medication rounds, medication word round, you said advice, please prepare medication per patient per time. Prepare your medication one patient at a time to avoid medication error. One patient at a time. Come to this bed, prepare the medication, administer and go. Then you go to the next patient, administer and go.
So we still have to see all of them.
Of course, you change your gloves. What if this patient is having contagious disease? You touch this patient, went down. See, sometimes in the hospital, what we practice is not it, right? Please be professional. You remove your glove, wash your hand, go to the next person again, do that till you finish at least. We are like your 10 o'clock medication, right?
But there are some hospitals,
Can we keep quiet, yes?
there are some hospitals that they don't have enough, say, any beds. Now, for example, some hospitals, maybe the matron can experience you from showing the weight loss all the time to tell you you don't have enough loss. Or some hospitals, sometimes there's no always running water to basically washing hands. So, how do you do it?
See, I advise my students, this is Africa, right? This is Africa where resources are being limited, isn't it? So you use the available resources to even protect yourself. So I advise you as a student nurse, or as a nurse, always buy a pack of glue. At least this latest glue, right? Buy a pack of glue. Whenever you go into the hospital, just pick like 5 pairs and go to the hospital with it. One, you are protecting yourself and you are protecting other patients. Do you understand? Always come with your glove. You are helping yourself, you are helping the patients at the same time. And water should not be a problem in the hospital. Whether it's fetching from the bucket or from the running tap. At least, if you're on duty, please don't be lazy. Ask the ward oddly. Go and get me water. Let there be water in the wash hand bucket like that one. Always wash your hands. Don't forget there are emergencies. When you are tired, maybe you are sweating, if the weather is very hot, you try to and there is blood in your hand. What do you do? So you have to perform your analogy, right? Don your glove. If it is stained, change the glove. You understand?
Lot of patients like that administer prescription that all over their bedtime nurses as treatments. How do you administer?
You still administer.
There was a time that I went to the hospital that physically said administer on the stretch
that stretch marks is superficial? Is the stretch mark deep inside the muscles? So what's your target? Are you pouring the medication inside the stretch mark? You understand? Yes, the skin is somehow stretched, isn't it? That is why it's broken. Somehow having stretch marks. Or the skin is reacting to something, that is why the skin is having what? Stretch marks, isn't it? So your target is what? The muscles. What about patients having burns all over? What will you do? So we'll come to that topic next time. And then we'll see how we can manage patients with burns. So as time goes on, we keep going like that from one topic to another. Then we know how to manage our patients, take care of our patients from there.
Please, what about, you said after giving the injection,
Keep quiet. Keep quiet. You don't make noise in my class, yes?
after giving the injection, there's some injections that you give at the deltoid muscles that you don't apply pressure on the...
Rather, you don't massage.
Okay, you don't massage. So, like, why is it that some you don't and some you do?
Do you,
Like for hepatitis.
yes, just apply pressure. It will just go down. Do you know that some of these medications being given superficially, isn't it? And you are massaging, do you know that it may, no, it may start coming out. I don't know whether you've seen insulin. Insulin is also subcutaneous or intradermal injection. You just apply pressure, you don't massage. It's only intramuscular. Flex and go. But this one is very, very superficial. It's down. Hey, have you seen paracetamol injection? Do you know that when paracetamol injection newly came out, it was so very thick. So when you administer to the patient, if the maybe using the Gluteal model, if the patient just sits like this, you see the medication coming out, staining the patient throat. That massage that they are going to massage will help you to absorb it, right? So for the other one, it's just like you are massaging the skin and it will come out. Any question? You want to pause it the time? Eh? So I'll consume my time. Any question? For intramuscular? No question. Well understood.
Yes, ma'am.
Who is there? Any question, class? Come and sign my attendance. Thank you for staying with us, Blessing Clement. Thank you. Bye-bye.
Bye.
Come and sign attendance.